We are live. Thanks.
All right, what an incredible day so far, full of information and assistance with regard to critical issues affecting the African and Caribbean communities in Birmingham, England. Another real important issue to discuss is dementia. And the question that's being raised is the African Caribbean community understanding the impact of dementia on the community. But we have an expert in that area with us today, Mr. David Truswell. And David has worked in community-based mental health services in the United Kingdom for over 30 years, developing services for people with complex care needs and enduring mental health problems. He's currently executive director of the Dementia Alliance for Cultural and Ethnicity. That's DEMACE.com, DEMACE.com, a United Kingdom social enterprise developed by local and national voluntary organizations working with dementia. David is a published author as well, including the book Supporting People Living with Dementia in Black, Asian, and Minority Ethnic Communities. And he's also contributed a chapter on dementia and its impact on minority, ethnic, and migrant communities within the International Handbook of Black Community Mental Health, published just last year in 2002. David is also director of Some Fresh Thinking Limited, a healthcare consultancy for service redesign and change management and health and social care services. David also has an exhibit booth here within the summit, and make sure that you visit after our talk, spend time with the exhibit booth, and view an incredible movie about this subject, dementia. David, we welcome you and thank you so very much for joining the Black Health Matters International Summit and sharing your very important knowledge with us today. David Truswell, thank you once again.
Thank you very much for inviting me. And I think also thanks very much to Birmingham for actually having a Black Health Summit. I think it's a great idea, and hopefully it will be taken up by other cities across the UK in the future. Without much further ado, what I'm going to do is hopefully share my screen. There we go. With a presentation to explore some of the issues that I think are important for the African Caribbean community when it comes to dementia. So firstly, let's start with, I think these slides are not quite working the way that they should. Yes, I thought so. Okay, let's start with Windrush, and not least because he's been in the media quite a lot recently. A substantial proportion of African Caribbean people, who are African Caribbean inheritance, who are living in the UK now, actually were part of that whole migration period that tends to be kind of summarized as the Empire Windrush period of the 50s and 60s. African Caribbean people have been in the UK for a lot longer than that, but that particular period was a point where there was a significant increase in the amount migrants. A lot of those people were people returning back to the UK after already having been here for a period, supporting the UK through World War II. A huge number of those folk were children or young adults, essentially because they'd been called by the UK government of the time to contribute to rebuilding the mother country in the aftermath of the Second World War. So many of them felt that's what they were participating in, and many of them also really saw themselves as British through that ongoing sense of connection with being part of the British Commonwealth. And that was very much emphasized by the information material put out by the UK government at that period in the Caribbean to encourage people to come to the UK. Lots of those folks expected to be returning back to the Caribbean after a period, certainly by the end of their working life, expecting to retire to the Caribbean. And that expectation in and of itself, whether people are living with dementia or not, has become really an enormous issue for the Caribbean community in terms of the changes in the countries, really, and the expectations and social expectations over time. At the time when many people came in the 50s and 60s, the average lifespan in the Caribbean was 51.2 years. Now, according to World Health statistics, it's around about 75 years, and across the board, really, for the Caribbean and Latin America, broadly speaking, the life expectancy is increasing. So somebody who arrived in the UK in their 20s is likely, if they're still alive today, to be getting into their 80s. So that becomes important when you think about the risk of dementia related to age. Generally, the case is that about 1 in 100 people between the ages of 65 to 70 are likely to be at risk of developing dementia, but that risk rises to 1 in 6 when you think of people over 80. But there's particular research, and I think there's been pretty well established by some of the research done over the last 10 years or so, that there's a higher rate of dementia and an earlier onset of dementia in the African Caribbean community. There's still a debate about the actual degree of higher rate, but it's pretty much well established that there is a higher rate of early onset dementia and dementia generally. Also, because of the way in which migration happened for the African Caribbean community in the UK, is that demographically, the African Caribbean community is the oldest of all the communities that are identified as being Black communities in the UK census. But that's important because when local services are doing something called JSNAs, which are Joint Strategic Needs Assessment, and thinking about dementia services, they often assume that migrant communities generally are younger than the white mainstream population. And they don't look at the differentiation between local migrant communities, because obviously in the UK, there are some areas where there are significant numbers of African Caribbean migrants, and it's quite likely that their demographic population is going to be older than some of the other migrant communities in the locality. Also, and it's been mentioned, I think, by previous speakers, the African Caribbean community, amongst other things, has higher rate of cardiovascular disease and diabetes, and both of these are more recently associated with increasing the risk of dementia. So quite a few of the kind of long-term chronic diseases that are more prevalent in the African Caribbean community increasingly are becoming associated with the higher risk of dementia. One feature of support and services for people who've been diagnosed for dementia is often inviting them to take part in groups or go out to day services, where part of the resource and support that's provided is reminiscence, people talking about their early life or younger life as a way of helping people to kind of feel included, share their life stories, feeling a sense of connection with people. And one of the really impressive things, again, in the last 5 or 10 years, broadly speaking, has been the explosion of approaches and information and material in relation to reminiscence that involves photography, different kinds of imagery, film, music, dance, games, maps of different places. It's people telling their stories, either people listening to people telling their stories on audio tape or video records. And certainly across the white mainstream, there's been an impressive increase in the kinds of information and material that's been available for reminiscence. Not so much so the African Caribbean community, and this applies really across the board for minority communities. There is very little. There are some organisations, one that's in the West Midlands called the Pearl Support Network, who've actually specifically been developing reminiscence material for the African Caribbean population that can be found online. That's Pearl Support Network. People wanted to make a note, but generally speaking, it's very, very difficult to find this kind of information for the African Caribbean community. And that information might include pictures of home life for people when they were growing up before they came to the UK. But bearing in mind that even the cost of the fare to the UK back in the 50s was about the same price as a decent month's wages. Many of the people who were coming to the UK for work didn't have much money, certainly didn't have the money to be buying cameras, and certainly may well not have thought of taking pictures of their everyday lives and people that they necessarily knew doing ordinary things and ordinary activities. If you look online for examples of photographs for the African Caribbean community in the 1950s, the things that you can see are the kind of things that you're likely to see. That's where I got these photos from. But more likely, you're going to see photos of local dignitaries being met by other local dignitaries or various famous people swanning about in the Caribbean, or alternatively, people in fields cutting cane. Meanwhile, over in the UK, certainly for the early part of the 1950s, very, very unlikely to see images of African Caribbean people in any media, really. The African Caribbean people essentially get treated like they were culturally invisible, and certainly unlikely to be in a profile of anybody doing photographs of everyday working class life. There are one or two exceptions, again, those exceptions include the photos here, but broadly speaking, invisible. So the extent to which there are any representations that could be used for reminiscence, to have a conversation with people about their life, particularly at that time of moving to the UK, if they're first generation migrants, is extraordinarily limited, particularly for those people who are now in their late 70s, 80s, even early 90s, who were part of that particular part of the Caribbean migration to the UK. So where ethnicity, and this applies broadly for migrant communities, but more specifically focusing on African Caribbean community, other health risks that are there for the community or lifestyle risks increasingly tend to be seen as risk factors for dementia as well. So a lot of those risk factors are also loaded onto the African Caribbean community. Some researchers are beginning to think that the really, a little bit like COVID, there's a host of socio-economic factors that all reinforce each other in increasing the risk of dementia for the African Caribbean population. As I said before, the migration history of the African Caribbean population skews the age population of the community towards it being demographically older than some of the other migrant communities. Often that means when health commissioners are looking generally at providing healthcare in later life, they tend to leave migrant communities to the margins, because overall they tend to look at the age demographic for the whole, all populations together, rather than look at different populations. When you look at different populations, there's that higher age of the African Caribbean community. Many people may well have come from areas, particularly first generation migrants from areas of the Caribbean that were quite rural and underdeveloped compared with what they find when they come to the UK, which means that their early experience is quite different from their children and their grandchildren, and even some of their people who are supporting them, even if they're from the same ethnic background, because they may well involve experiences and senses of ways of speaking about things that are different from the way that certainly the second generation has grown up and had their experience in the UK. Also, it's a huge thing, certainly in my view, for everybody in all communities now, living much longer, which means that people are living much longer and therefore more likely to be living not just with a higher risk of dementia, but also other long-term conditions, and also caring for and supporting people with complex long-term conditions, including dementia, for many, many years, because people just live longer than they used to. And that is a new thing for everybody. A colleague of mine who I'm in my 60s says he's the only person of his family that has all four living grandparents, and that nobody previously has actually been living at the same time as all four living. That's maternal and fraternal grandparents. The lack of reminiscence material then often means that the ability to support people from minority communities, including African Caribbean people, is extremely restricted because there's nothing there essentially to start telling the stories about, because the material that might encourage reminiscence isn't available. There may be language or education challenges. That's not just in terms of people speaking different languages, but speaking, having dialect terms from their early life that may not be in use in the modern day, or may still be in use in the Caribbean, but aren't in use here in the UK. There may have been limited education opportunities in the Caribbean, although not so much for the, again, people might want to challenge me on this. I think not so much for the Windrush generation, because really that was the best of the Caribbean population at that time, coming here to the UK to work across public services, often at levels that were well below their ability and talent. There have been intergenerational shifts in expectations with families, not just in terms of obviously expectations around supporting elder family members, but whether that's even possible with modern lifestyles, people living a long way away from parents or relatives, people having other consuming things, other caring challenges like looking after children, or maybe more than one person in the family needing family support. An issue that's often not considered is, particularly again from that first period of the Windrush, the trauma involved for people when they experience the, never mind institutional, naked racism over in the UK, you know, I think famously summarised by the "No Blacks, No Dogs, No Irish" notes on boarding houses. Many people have never spoken about what that left them feeling like. Often it happens that, as with many communities, that Caribbean people are treated as if they're just one type of people. But as anybody knows who knows anybody who's Caribbean, the island identity is really quite core to their understanding of who they are. So a Bayesian and a Jamaican are not the same kind of character. They will not feel themselves to be the same kind of character. The Antiguan is not Bayesian. Somebody from St. Lucia would not regard himself as the same as somebody from Jamaica in significant ways. And last but not least, people are afraid of losing their sense of identity and their sense of resilience and independence if they start talking about the vulnerability they feel about feeling like they're losing their memory, feeling like they're losing their understanding of who they are, where they live, who their family is, etc. So I think all these things, I'm ending there, but I just want to very quickly, I can do this because I almost forgot. And I know I've got a question in the chat, but you can get more information and resources from my book. Details are there. Resources on our website, www.demace.com. And I stand in the virtual lobby here, which includes a short video that we developed with Health Education England of a Caribbean family trying to come to terms with the mum developing dementia. That video is called Finding Patience. Stop the share now. have a look what's in the chat. Okay. Q&A. Just to answer the question that's in the Q&A. Oh no, okay. Just to answer the question in the Q&A on reminiscence, I think we need to work more with the community organisations to help to develop resources that will allow people to see stuff that reminds them of themselves and help them to tell their stories. And a lot of community organisations do have photos, and certainly when we move out of photographs into kind of songs and movies or pictures or iconography, all those things I think can be used to help reminiscence. Does anybody have any questions or comments? Oh, there's a Q&A. Thank you. Okay, now we get the question. On the question about comparisons, Caribbean and Africa, that's a really interesting one, because I don't think there's even comparisons between the UK dementia instance and the Caribbean dementia incidents. And there's a lot of at times unhelpful speculation about the links, but it needs to be backed up by better evidence. And certainly when it goes back as far as comparing with Africa, I don't think there's really any substantive evidence one way or another. And certainly at the World Alzheimer's research level, over the last couple of years, there's been more and more calls for research into what's happening with dementia in the underdeveloped world. Another question about care homes for back. Again, I think it's got to be about the quality of the care homes. I think the option should be there to have Black Caribbean and Black African care homes, but recognise the fact that that's not necessarily what everybody wants, but what everybody, I say, the people I spoke to, in terms of what they would like to see is a sense of being understood, and their cultural history and aspirations and what's important for them being understood, whatever care home they go into. Somebody asked me about looking after a family member with dementia. It's a huge question. I think there are good resources on our website. It looks like I've run out of time. I'll type answers to the people I haven't answered.